Hi, everyone. Thank you for joining us. Today we have Dr. John Nosti and Christy Lynn with us. Dr. Nosti is a functionally driven cosmetic dentist that's been practicing in New Jersey for over 22 years. Hello, Dr. Nosti.
Hello, how are you today?
Doing well. And Christy Lynn, she's actually built a following on social media with her YouTube channel, I Wear Dentures, and she educates consumers on the expectations and realities when it comes to dentures. Hi, Christy.
Hi, good to be here.
Yes, thank you both for joining us. So, I think we were all taken by surprise when the COVID-19 pandemic started, just a few months ago. I hope that both you and your families have been staying safe and healthy. I know now that offices are opening back up, there are a lot of questions, I think, regarding dental visits. What will they look like today? What can people expect? So I really wanted to get you two together, really to have a conversation between a patient and a dentist. I think to talk about some of the fears that patients might have, what can patients expect as they go back to the dentist, and also why is it important to go back to the dentist and not really leaving things for too long. So to start, I just wanted to ask Christy, what were your initial thoughts as a patient about the situation and dentist office opening back up and going back into the practice?
Well, I actually had my appointment for my routine cleaning maybe a week before everything started shutting down. My oldest son, he's got special needs. He's considered at risk, even though he's young. He's got multiple things going on health-wise, and I was just very scared to leave the house and go around people. The dentist office, that was like one of my big fears, is because all of the kids needed cleanings. My husband, he's got some issues going on with his teeth right now. And when you think about it, when you go to the dentist, like my first thought is you are coming face to face with somebody. Even though there's a mask, you're just in such a small room. And I didn't know what that would look like, if that was like a risk factor or not. And you're hearing all kinds of stuff on the news on, tons of different information. So I honestly didn't know what to think at first. It was just general anxiety over it.
And so, Dr. Nasti, what about you? When this pandemic really started and offices started closing, what were your initial thoughts about everything?
As someone who travels around the country, my initial thought was that, this wasn't going to be as bad. We'd be in for, 2 weeks, as they were saying, to try to flatten the curve. Um, Initial reports going back, in early January was that, 80% of the people don't have a problem. It's kind of like the flu, and it shouldn't really be that bad. So, I looked at it like, "Oh, okay, this is going to be 2 weeks out of my office. That's not planned. I get a little vacation, get to, be at home with the family, get to focus on writing some more articles and just getting, a little bit of extra downtime." So at first I wasn't so concerned about it until, really having, friends and family members who are healthcare workers and seeing the impact in New Jersey. That's when things started to become, a concern for us.
Christy, as a patient, I mean, we were all kind of in the unknown here and what was going on with the pandemic, when things would be opening back up. What were some of your specific fears? I know you've even talked to some of your followers to see what were some of those fears and anxieties that you were talking about going back to the dentist.
I think that it was just, there wasn't really anything specific other than the fact that, when you're at the dentist, you think that you're going to be very close to other people. You're going to be in a seat that may or may not have been disinfected properly, and the tools, they're checking out your teeth. I mean, it's just a very close situation where it seems like you would be more at risk of getting sick. And it's, not even like, for me, I'm young and I'm healthy. I don't want to get it, like regardless of if I'm young and healthy, I don't want to get it. I don't want to give it to any of my family that could be considered at risk. So it was just that anxiety over it and not knowing. And I think that a lot of my subscribers echoed those same fears, like just walking into it and not knowing what to expect, pretty much.
Okay, and yeah, obviously as a patient and just going out, we're concerned about catching the virus, but also from the dentist standpoint, you would have, I imagine, similar fears when you're going back to the office. So what kind of fears did you have, Dr. Nosti?
Our office stayed open to treat emergencies. So I think that definitely alleviated a lot of the fears for me. Going in, 2 to 3 times a week to see a couple patients a day, um, you know, that really helped, us move along. But, then, before we came time to actually open full time again on June 1st in New Jersey, I really started to just think about, over the years, if, you know, looking at how many patient, not to say confrontations, but visits that I've been with, in 20 years practicing, I think I had the flu maybe once in 20 years. So you look at it, you know, I've been rarely sick in my life. I mean, I think I can count on one hand the amount of times that I've missed work due to being sick. So if I'm always in that environment, this is really not much different. I mean, sure, you might be dealing with something that, if some people catch it, it's a bigger concern, but, there's still people who are sick every day. There's still people who have the flu every day. And knowing that, from the dental practice, really it's the safest environment to be in because unlike a lot of other healthcare professionals, we are always wearing masks. I mean, I wear glasses. A lot of my team who are treating patients chairside, they are wearing shields. The loops that I wear put me at a pretty significant distance from the patient's mouth to begin with. Um, and just all of the things that we practice in terms of infection control, where there's plastic on like almost everything that you touch, the cleaners that we use in between patients, that are designed to kill hepatitis B, which is, way, not to say way more dangerous, but it's a stronger, um, basically virus that it can last in blood, dried blood for a period of time where the coronavirus, really doesn't last a long period of time, on surfaces. So, once we really came back into it and we saw, just how, again, what most dental practices are, we really took a step back from how we thought news media might be scaring us in a way. I mean, we really felt more relieved about it, actually.
Yeah, I mean, obviously you have to take it serious, but I think because this is such a new virus that nobody really knew about, depending on who you're watching online or on the,
Absolutely.
you're getting all of these different reports on, this is crazy, this is out of control, run for the hills. And then other people are like, that's like a mild case of the flu. So really, like as a patient, you just don't know what to expect. And you don't know if the dentist is taking it serious or are they going to be one of those people like, no, I'm not worried about it. Like, we're just going to do whatever here. So I think that that's like the biggest, that plays the biggest role in how we approach it and our fears and everything is just we don't know what to expect. So hearing, about how the dentists always keep their offices clean, that's, you would think it's a given, but unless you hear it and really know exactly what's going on behind the scenes to make sure that there's like impeccable hygiene and disinfecting going on, then as a patient, it's kind of scary walking into that during this time.
Absolutely. I mean, I would even agree with you and even say, that's a perfect opportunity to have an open dialogue, even obviously via phone, with your dentist's office, their office manager, even their front desk should be able to answer those questions pretty easily. And I would almost even say that they would welcome your questions because, any office that's not only practicing the norm, but even superseding, what is basically required of us right now, would absolutely be happy to alleviate any fears you have about coming into the dental practice.
Yeah, and I think that any opportunity that you can have to share the information on what your office is doing, that is so much appreciated. I work in construction lending, so I deal, with title companies and this and that, people coming in to sign mortgage documents and whatnot, and they've got autoresponders going off about all of the different protocol that they have put in place to make sure that anybody coming into their office is going to be safe. So I think that some of my subscribers mentioned that their dentist offices were doing something similar and sending out text messages, sending out emails, giving courtesy calls, letting people know what you can expect. And I think that that is so important to know. I'm not just going to show up here and it's just going to be business as usual as if we're not in the middle of a pandemic. Just having that addressed beforehand really eases a lot of people's fears.
Yeah, absolutely. And you said a couple key things there about, maybe obviously reaching out to the patient population ahead of time, letting them know what's happening. Our office is doing that. I would expect most offices to be doing that. If offices are listening right now and they're not, I mean, you heard it, straight from Christy's mouth. That's definitely something that you want to be doing for your patients. And again, if patients who are listening, you can pick up the phone and see, what maybe is going different in your dentist's office than what was happening before. It is possible because a lot of us use, softwares that blast emails out. So it could be possible that maybe, your dental office has tried to email you and maybe it went to a spam folder. Maybe someone typing in your email address might have typed in it incorrectly. So even though you didn't get an email, doesn't mean that it didn't go out. So that's something that's really important to consider. But there are a lot of differences that are happening right now. So even talking about, what would the dental office visit look like now from before? I mean, I can tell you that, being in touch with a lot of dentists across the country, many offices right now, there's no such thing as a waiting room anymore. So, typically you arrive to the office, you're in the parking lot. Some offices will have you call when you arrive to let them know that you're in the parking lot. Other offices will just say, okay, your appointment's at 4 p.m. Let's just say we're going to call you at 4 p.m. to see if you are in the parking lot. So, but regardless, still we're having patients come and wait in the parking lot. When they come into the office, they're greeted by one of the staff members. Many times now, even though it might seem a little silly to wear a mask into the dental office, we're still having patients wear masks into the office. We're using a non-contact thermometer, at our front door, and we're taking, the patient's temperatures before they come in. All of our team members, when they arrive to our practice in the morning, we're taking temperatures on each other, and the patient's being escorted right from the front, right into the operatory that they're going to be seen in, whether or not they're seeing the hygienist or me, the practicing dentist. And then right before they leave, we're typically making the appointment in the operatory so that many times they are exiting right out of the office, not even stopping at the front desk. So there's very little contact time, if any, between patients, and just limiting the amount of contact time, even within team members, in the practice at that point in time. Many times, even before the patient's coming in, we're doing a screening questions on patients. We're asking them, have they been exposed to COVID-19, at all? Have they been tested for COVID-19? Have they had a fever within the last 2 weeks? And sometimes we're even asking, have they traveled outside of the country, even though that's a little bit silly right now because everybody's been on lockdown. But those are typically the parameters that we've put in place, and I know many practices are putting in place, just to make the dental office the safest place that you could possibly be right now.
That's what I think that people really need to hear before they make their appointment. What about common areas like a restroom where a patient, has to use the restroom? What are you doing to make sure that all of that is kept clean in between, different patients coming in?
And that's a great question. So if the patient does have to use the restroom, obviously they're told to wash their hands, coming out of the restroom. We have like a little bit of a signal where the patient kind of leaves the restroom door open, and then one of my designated team members going in, and they're using the chemicals that we use to clean down the operatory. It's sprayed into the bathroom on all common surface areas, and then we then close the bathroom door so we know that that room has been turned around. So those are some of the things that we have been doing. Even if the patient goes to the front desk and touches things at the front desk, uh, we are wiping those areas down, in between patients. Once in a while, we have had some elderly patients who are coming in, and they are accompanied by someone because they might need help getting in and out of the office. That person is sitting as far away in the reception room as possible, and those areas are being wiped down as well. There's no magazines. There's really nothing you can really touch in our reception room right now. That's all been pulled away, just to basically eliminate any possible cross-contamination. So all the doors and handle knobs are being wiped if patients touch them. I mean, really, if you think about it, it's safer than going to your grocery store where, none of those things are being wiped down, in between, people touching and different areas. So, it's working out really well.
Yeah, that sounds like a plan, honestly. What about the courtesy items that you would usually get at the dentist, like a toothbrush or even business cards? Like, are there any exchanging of items or anything like that, or has that stopped?
We're still doing that, but all of those things in our practice are kept in, drawers. So there's no contamination on those things, and all of the things that we give out are in sealed containers. So even if the patient had a concern about it before they're being handed to it, I mean, the hygienist or my assistant can easily wipe those things down before they're put in bags. But there's basically no contact on those things. There's no chance of having any aerosols or anything getting to those things until it's delivered to the next patient. That's a great question.
Right. Yeah. I think that that's like my biggest concern is that, are you taking it serious? If I feel, and that's even like with my children and their friends that they want to hang out with, like, what are your parents doing? Are they having parties on the weekend? Are they going out to, big, large crowds and events and stuff like that? As long as I feel like the person that I'm with is taking it serious and I feel a little bit more comfortable. So just hearing about all the different things that your office is doing, I can see how that would make someone feel a lot better. But where are you getting your guidelines from on how to manage all of these things, on what different types of procedures and protocol that you need to put into place?
Great question. So that's going to be different from, even internationally. If you have, people who are following you from Canada, there's going to be some different parameters in place for Canadians than there is for, people in the United States. For the most part, that is being run by recommendations from the American Dental Association, recommendations put out by the CDC, and then recommendations to the state board of dentistry of that state where that dentist practices. So, what I would say, to patients out there who are concerned about going to the dentist, if your dental visit is very similar to what it was before COVID-19, maybe you should have a little bit of concerns. If no one's asking you questions ahead of time, if no one's taking your temperature, if the team is in the exact same attire that they were before, if they're not in disposable gowns, or if they're all not in scrubs with covers, if they're not, having shields on or wearing masks, if you see things that look business as usual before and now, that would be a little bit of a concern. But if everybody is doing exactly what I'm saying, then rest assured, all the things that even you're not seeing, they are definitely doing, because, my team is taking it seriously to protect themselves, which is also protecting the patient. So, if you have a team that they themselves aren't protecting themselves, that's a concern.
Right. Do you talk to other dentists, and does this seem to be something that is routinely happening with most of them?
Yeah, oh, absolutely. I mean, I can tell you ahead of time that, this might seem, weird for people listening, but, before this happened, I practiced in a lab jacket that looked like a suit jacket. So I didn't wear a white coat because I thought the white coat has been out of dentistry and medicine for a long period of time, but I wore a black jacket that looked like a suit jacket, and I wore a shirt and tie, and I wore slacks every day to my practice because doing high quality cosmetic and reconstruction dentistry, I didn't want to look like that I was just wearing pajamas, let's say. That's how I kind of that's how I looked at scrubs, that they were wearing pajamas. So if a patient came to my practice, I wanted to look, like I took the time to, you know, be respectful to that patient who's coming in. But I can tell you now that's out the window. We are all wearing scrubs. We're wearing nice scrubs in the practice. For the most part, we're either wearing disposable gowns over our scrubs and changing them throughout the day anytime we create aerosols. And what we have done in our practice is we actually subscribe to a gown service, much like hospitals have, where they're not disposable. They're like an OR gown that you put on and that you take it off and you put it in like a hazmat bag. And those are cleaned and laundered by service. So, those are some little different things that are different now than were before COVID.
Wow, that's that's pretty extreme, but I mean, I guess you have to do that. What about when you disinfect the office? Like, are you using the same kind of cleaning products, or have you upped that ante a little bit? What are you doing differently now with that?
That's a great question. So even though this is not a recommendation, the first thing that I want to say is for the most part, a lot of dental offices use a chemical called cavicide. So um, cavicide is an extremely potent chemical. It kills everything and anything. One of the things about cavicide is if you spray it in the air, it lingers around for a period of time. It works great, but it's not something that you want to walk in and breathe because it smells bad. And over time, it's worked so well, it's very caustic to your materials, to your dental chair leather, things like that. It breaks it down over a period of time. So, we wanted something that we can do that we can put into the air that would actually have the office smelling better and that would work really well, but wouldn't be like this toxic cloud that would address people. So, some of the things that we have been doing is, we are having patients pre-rinse with a chemical called hypochlorous acid. So you can look it up online, and that is something that a lot of organic farmers use as a no rinse pesticide. So what does that mean? They can spray it on the chemicals, spray it on the vegetables, but it's not a chemical that you have to rinse off because it's non-toxic. It has the cleaning power of 80 to 100 times that of bleach. So that's how strong it is. But you can rinse with it. You can swallow it. The reason why you wouldn't want to routinely do that is because it's such a good bacterial agent, meaning it kills bacteria, also kill the good bacteria in your gut flora. So it's not something that you want to, really think, but you can rinse with it. So it kills coronavirus, which is excellent. Not a lot of things that you can rinse with will kill coronavirus, like chlorhexidine, which many dentists have their patients rinse with ahead of time. That really does nothing for the coronavirus. So we switched to hypochlorous acid, which is something we make fresh in our practice almost every day. And then what we are doing is we bought fogging machines, kind of like what you would see, on, at a movie theater or a movie basically stage where they create fog and mist. Well, this is something that hypochlorous acid is going in these foggers. And anytime we do a procedure that creates aerosols like drilling or using a cavitron, my girls come in and they will fog down the room, for 2 to 3 minute period of time. And what that does is any aerosols that are in the air, this is going to come in and kill the aerosols in the air and then drop it to the ground. And then they go in and they wipe all the common areas. So it's kind of like a 1-2 punch of hypochlorous acid and then a chemical called caticide that we have always used in the practice. And those are some things that I know a lot of offices are doing across the country, again, because they want to, again, not only keep their patients safe, but they want to keep their team safe.
That's pretty awesome. Do you think that that's something that you're going to continue to use after all of this is over and done with, or?
You know what? I think we will. I think what we're going to have to do is just have to find better foggers, because we've already burned through one of them. Didn't work out too well. Foggers are hard to come by now, so it's like kind of like the latest and greatest. A lot of medical offices are doing it. But what's really cool is that, it gives the office a fresh smelling, uh, smell, because it's kind of like sterile air. So I think one of the things that we are doing long term is we have air purifiers that are coming in that turn the office air over every 30 minutes. And it's not just a HEPA filter, which cleans the air. It's actually something that takes any particles in, destroys the particles before releasing the air back out. And I know a lot of dental practices are doing that as well. So, you could look, ask your dental practice what they've been doing. They're probably looking at their website, and they're probably even advertising on their website, all of these measures that they have been doing, just to keep everybody safe, because they want you to know that they're not only, following the guidelines, but they're definitely, superseding the guidelines.
Yeah, definitely. So all of those things are reassuring to me. I mean, my husband, he just recently went back to the dentist. He's having issues. He's got some bone loss. We don't know where that's coming from. So it was extremely important for him to get back to the dentist. And my kids, I need to call and set their appointment up, because it was like last month they should have went. And I have 4. So all of them need their cleanings. And I know how critical it is for you not to miss out on that. What would you say as a dentist, like what to somebody who is a little skeptical but kind of knows they need to go? What do you say to those people that should definitely get back to the dentist now?
So, speaking to the fearful patient, I mean, we definitely understand how you feel. Pick up the phone, contact your dentist, let them know how you are feeling, how nervous you are, and let that office put you at ease. That's number one. Number two, I'm going to tell you as a patient, my concerns about you putting off your dentistry is that, things can potentially get a lot worse. You can unfortunately lose teeth, because of putting your cleanings off, especially if you have periodontal disease, which is bone loss. If you have cavities, obviously cavities only get bigger. And as they get bigger, they definitely become more costly to fix. So getting in there now is definitely, paramount before that happens. And again, just kind of, to reassure you, um, you know, most dentists out there, and of course I can't say everyone is, but I'm pretty tuned into a lot of social media groups and a lot of just online forums of thousands and thousands of dentists, and everybody wants to protect themselves, which is also going to protect you as the patient. So pick up the phone, call the office, ask them what they are doing, and how they're seeing patients, and everything that's happening, and they would definitely be happy to set your mind at ease.
Yeah, I think that it's extremely important. And even for denture wearers, a lot of denture wearers, sometimes they'll think, well, I don't have any teeth to take care of, so I don't really need to go. And that couldn't be further from the truth. Like, denture wearers deal with all kinds of problems, like loose fitting dentures. Sometimes they need relines or adjustments to their dentures. If you've got something that's not fitting properly, it can cause sore spots, which can create an infection. And it's better to just go ahead and get it over with. Go see the dentist, let them decide whether things are good or not, so that any issue that might arise, they can go ahead and jump on that before it turns into something a lot worse. Wouldn't you agree?
Absolutely. And one of the really, let's say, not to say good things, but, you know, coming in and having a denture adjustment, that doesn't create aerosols. So, you could basically come in and the dentist is definitely happy to see you, even if they've limited their practice right now. That's something that they should be absolutely willing to get you in, get you getting taken care of before the problem gets worse.
Yeah, that's good to know. So, um, what would you say to somebody who's just not sold on it? They don't care what you're doing. They're just afraid and they don't want to go. What would you say to them?
For the people who still want to lock themselves in their house, because I know, I love my friends, family members, and neighbors, and we're talking to a few people last night who definitely are still nervous about it. And one of the things that we really have to think about is locking yourself in your house is not a good thing for you. It is good to get out. Tons of studies have shown that your immune system will actually become more compromised staying home than getting out in the open. So you definitely want to get out, go for walks, not to say expose yourself to the elements, but you definitely want to, the little adage of, kids who play in dirt, they don't get sick that much. I mean, there's something to say about that. So you do want to get out. In terms of if you are absolutely fearful about going to the dentist, I will tell you, if you're someone, you don't have periodontal disease, you don't have cavities, you're going to the dentist every 6 months and you always get the gold star. You know what? Putting things off for 2 months, 3 months really should not be a problem. But again, think about those parameters that I said. You always got the gold star. You had recent x-rays that said you had no cavities. You do not have periodontal disease, and you're not currently having any problems. You can still wait a couple more weeks and you really shouldn't have a problem. But pick up the phone and call your dentist. Let them know how you feel, and then let them talk to you about all the things that they are doing, because rather than sitting home and just thinking about it and creating a story of what's happening, let the dentist tell you what they're doing, and then you can decide what you want to do. I think that would be a good move for anybody.
Right. Is there a certain time that you would recommend for these patients to
You
go see their
know,
dentist?
um, you do want to still stick to every 6 months. So if you're someone who you were just in January, right before the virus hit, you can definitely put it off to August, September. If you're someone that you are already overdue and you hadn't had x-rays in a year, I'm going to tell you that even if you wanted to go to the office and just get an exam and not have your teeth cleaned because you didn't want to have, sit there in the practice for a long period of time, you can request to be seated in a room that no other patient has been in that day, or best yet, my advice to you would be schedule to be the first patient on a Monday morning. Chances are the practice may or may not have been open on Saturday. Even if it was, you have a 48-hour time period before anyone else has been in that practice. You're coming in and you're seeing the team, and they're probably taking temperatures on themselves and making sure the team is up to par. And now you can come in first thing Monday morning, and that's going to limit any possibility of having any cross contamination.
That's a really brilliant idea, actually. I think I might do that with my kids because I have too many of them.
First thing in the morning, it's good, always a good move.
Right. I never would have thought about that. I never would have crossed my mind, but it makes sense. You know, I get online and I watch the news. I see all the stuff that my friends are sharing on Facebook. There's a barrage of information. None of it makes any sense. It's all contradictory. one of the things that I heard was that dentist's office, that dentists in particular are at the highest risk of exposure to the virus. But it seems like with all of these different things that you put in place, I know they're not doing that at the grocery store. They're not doing anything close to
Right.
that. So what would you say to people who feel like they would be more at risk because dentists are seeing all of these patients?
So, what's really funny is, when you sit there and think about some things in science and in medicine, sometimes we say things that on paper it would look like it makes sense, or saying it out loud looks like it makes sense. But when you actually look at numbers and results, you realize, well, why is it the way that it is? So, let's look at, for instance, the flu. And we see that, and I'm not trying to just say that, COVID-19 is just another flu. I'm not saying that, but, let's look at, how many dentists out there, are there, how many practices are inundated from the flu every year. And, you know, I would say that if we were so susceptible, like every dentist every year would get the flu, because even though you're practicing with a mask, you're going to see patients who come in, and sometimes 30, 40 patients a day. During flu season, the likelihood is you're probably seeing at least two people a week, I would say, who are in the primary stages of having the flu where they can be contagious for you. But we just don't see those numbers happening. So, and we look at it, well, maybe why is it that way? So then let's think about it. It's like, well, many dental practices, they are all wearing very high level masks. So, they're changing their mask at every patient that they're seeing for the visit. They're wearing a shield. They're washing their hands in between, all patient encounters. So all those things, it's just that we look at it, it's like, okay, that really does minimize the risk. Now let's talk about the cleaning solutions that we're using. So I would say yes, if you're going to the dentist and they're not wearing a mask and they're not using, cleaning solutions in between patients, then I would say absolutely. It's we're really susceptible, right? Because the aerosols, you're creating aerosols on all new patients, and they're saying that's where everybody's going to get it, from aerosols. So, the dentist creates, that's the job that creates the most aerosols. Yet, we don't see that translating. And how do we know that? It's like right now the American Dental Association is tracking that. If a dentist, encounters a patient with COVID and gets COVID, I mean, they are supposed to be reporting that to the American Dental Association through the CDC as well. And, still right now to this date, there's just not cases that are translating that way. So, that's another reason why I can come on here, with a level of confidence saying, it really is a safe place for you to be right now.
Yeah, that makes sense. And you probably got a real, I've never been there. I haven't seen pictures. I'd like to see, but I bet you have a really nice practice. And that's one of the things that I've tried to communicate to my subscribers and any kind of professional that might be watching my channel, is even when there's not a global pandemic, that is so critical. When I walk into an office that is there, I know they're going to be all up in my face and in my mouth. It better be clean. Like, it better be cleaner than my house. Like, it better be the cleanest place I've been in, because that to me seems like you could get sick in that situation. And so my dentist here in Jacksonville, as soon as you walk in, it's immaculate. You can tell that they are cleaning constantly. The bathroom is wonderful. I don't feel like I'm at risk for anything on a normal day. I would feel very comfortable going to her office during a situation like this, because I know she's always maintaining those standards. So maybe if some of the patients that have these fears have dentists that aren't keeping their office like that, maybe they should reconsider finding another dentist that does, right?
Yeah, I mean, I hate to throw anybody under the bus, but if that's the case, there's definitely other dental offices out there, just as your office, as my office. there's many dentists out there who are exceeding, the CDC recommendations, and they would love to have new patients.
Right. Yeah, I mean, there's definitely bigger fish to fry if your dentist office is not maintaining this on the regular. So, anyways, yeah, that really answers a lot of my questions, and it's not every day that you get the opportunity to talk to a dentist about all of these fears and concerns. So I really think that this is going to help a lot of people who are sitting at home contemplating going back to the dentist but haven't quite made the jump yet.
Do I really want to be going back and, doing smile makeovers and things like that? But, looking at all the things that we have available to us, all the ways that we can clean the room, that we can protect ourselves, I feel, not to say just as safe as I was before, I actually probably feel safer knowing that all the extras that we're doing on top of it.
Yeah,
Um,
definitely.
this is, I mean, great information for me as a patient. I like to hear all of this. So, Christy, how do you feel now hearing this information and knowing what Dr. Nosti, but other dentists are doing out in the country? How do you feel about going back to the dentist now?
I I feel like I'm okay with going back to the dentist. In the beginning of this, I'm not gonna lie, like this kind of stuff really freaks me out. It just does, because all of these different variables, not knowing what source of information is trustworthy and what's not, hearing so many different facts that you can't yourself verify. I had no idea what to expect. So for the first like month or two of this, I was just like, my husband's going to do all the grocery shopping. I'm not leaving. I was working from home. My kids, there's four of them. They're doing their school from home. I'm not even worried about that. Their teeth are fine. We don't have to set up the appointments right now. We could just wait a little bit longer. But as you start to get more information and people are starting to kind of understand things a little bit better, and just seeing how serious a lot of people, even in my profession, the field that I work in, seeing how serious they're all taking it, it's made me feel a lot more comfortable in knowing that we've all got the information now. We know what we need to do to stay safe, and now it's more about just common sense. So my husband's already been back to the dentist since all of this started. He went last week. And then my kids, I'm gonna be making their appointment soon, and they're gonna be going. And I feel like, we have selected dentists that we trust. We feel comfortable with them during normal times. And like I said, my dentist, she keeps her office just immaculate. It's amazing. And I feel a lot more comfortable now knowing all of those things. So I'm ready to get everybody back there.
Great. And I'm sure, Dr. Nosti, you're excited to have all the patients back. So how do you feel now that everything's kind of opening back up?
So as I was saying before that, I'm very thankful to be back in practice. It's something that I love doing. I'm very happy to be seeing my patients again. And, as I was telling Christy before, I feel very safe and very comfortable practicing dentistry, knowing the level that we're doing to protect ourselves and our patients. I feel very confident that, it's a safe environment for, my team, myself, and my patients to be in.
Like I said, my son, he's got health conditions, and my husband even has some risk factors. And I feel very confident that the people that are taking care of our teeth on the regular are doing a great job at making sure that people are at minimal risk of getting this. So
I have a son who was born premature, so he has health issues as well. So, anybody who's out there can know that, if I feel comfortable about going to my practice and seeing patients and coming home and hugging my son, they can feel, very safe going to the practice as well.
Thank you both for having this great discussion. Like I said, I think it's something that's on a lot of people's minds just going to the grocery store. So I can only imagine going to the dentist as well. And I think you cleared up a lot of concerns that people might have had, Dr. Nosti. And thank you, Christy, for asking the tough questions that we know people are asking out there.
right.
Um, yeah, so I just wanted to thank you both for joining us. And yeah, this was all really great. So thank you.
All right. Thanks for having us.